Bismillahirrahmanirrahim. I am Dr. Sajad, lecturer Physiology department. Today we will discuss about the examination of the chest. So in examination, you have to approach the patient from the right side, and then greet the patient and ask the name of the patient, and then introduce yourself in your local language, the language which patient understands. Explain about the examination. Then come to examination. Like other systems, you have to do the same steps for chest examination, lungs examination. You have to do first of all inspection, and then palpation and percussion, and then auscultation. So let's start your examination with the inspection. In inspection, first of all, you have to expose the patient. If the patient is male, then it's easy, but if the patient is female, then you have to take special permission, or you have to accompany your female colleague, or you have to accompany the attendant of the patient. And after exposure, you have to check for the you have to see the shape of the chest, and you have to check if there is any spine deformity or not. And then you have to check the movements, the both sides of the chest are moving equally or not. And then you have to check the symmetry, that if one side is prominent and other side is not. If any asymmetry is noted, then note it down. Then check for the pulsation, any visible pulsation, pulse like occurring in the superior vena cava obstruction. You can see visible vein. And then you have to check for the respiratory movements. In adult, the in adult male, the movement is abdominothoracic. You should note it down. Then you have to check the skin. If there is any lesion on the skin, or if there is any scars, any previous surgical scars, or any kind of boil, or any skin tags, you have to note it down. And then check for the subcostal angle. It is there any recession on subcostal angle, and then check for the special signs. Then come to the shape of the chest. uh, once you come to the clinical, you will know what is normal chest, and you can differentiate it with the abnormal chest, like a barrel shaped chest. In barrel shaped chest, it is in the diseases like COPD, chronic obstructive pulmonary disease. And then pigeon shaped chest, which is pigeon chest is congenital deformity, and then rachitic and funnel shaped chest, which is pectus excavatum or pectus cornutum. Uh, Pectus excavatum is sternum in is the chest in which the sternum is depressed, and the pectus cornutum is the chest in which the sternum is protruded. You can see here the barrel shaped chest. This is the barrel shaped chest. This is pectus excavatum. You can note here that the sternum is depressed inside, and if the sternum is protruded outside, then we call it pectus cornutum. So now let's come to the palpation of the chest. How to palpate the chest? In palpation, first of all, you have to check the respiratory movements. If there is any pulsation, you will feel it. Any palpable sound like ronchi or wheezes can be palpable. Vocal fermentation is nowadays excluded, but you can still check it, or your examiner can ask you to check the vocal fermentation. Then you can ask the patient like this to say teen 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 or 999 in all the areas one by one. And about the position of the trachea, it's very about the position of the trachea. It's very important to palpate the trachea. Uh, this is how you do palpation. You do in three areas: top of the scapulas, beneath the nipples, and at the level of the diaphragm. You have to check both side of that both movements are normal or not. In certain conditions, chest will not move properly. You will say that the pathology is on that side. Now come to the palpation of the back of the chest. Your hands will be like this. Again, you have to palpate on three areas. Uh, and for chest expansion, you can measure with the measuring tape. Uh, Now come to the palpation of the trachea. You have to put three finger, and with one finger you have to feel the trachea. Normally it's central in position, and if it's deviated from the position, then there is some problem. You will see whether it's towards the side of the lesion or away from the side of lesion. Then there are certain causes of deviation of the trachea, like in collapse is deviated towards the same side, and in consolidation trachea is deviated. In pneumothorax is deviated towards the opposite side. So you have to note it down if there is some abnormality. Now let's come to the next step, which is percussion and the percussion techniques. For accurate perfect percussion techniques, you have to watch the videos. Okay, how you will do the percussion? You will use one middle finger, and with the help of the other hand middle finger, you will strike the mid phalanx of the other middle finger and percuss each and every intercostal space. You have to start it from the from the top of the scapula, and then go downward and percuss all the areas. It will be on the back of the chest, but don't percuss on the bone because it will give you good sounds. This is how you do percussion, but your nail should be cut because it can harm the patient, so you have to take care of these things. So it is the interior part of the chest, and you have to percuss on all the areas which are shown here on the with the blue color. So these are the areas you have to percuss here. And similarly, for the back of the chest, you have to percuss on the all areas which are shown in the blue color. You need to appreciate the dull and resonant note, and that only you can learn by examining a normal person. You can try it at home on any child or anyone, but you have to watch the videos and then practice. But when you will come back to college, inshallah, we will also do practice here. It's just a guidance video or guidance for you guys. We will practice it again, inshallah. Now come to the last and most important step of examination, which is auscultation. In auscultation, you have to check for the intensity of the breath sounds and the type of the breath sounds, and is there any adventitious sounds or voice sounds, which is vocal resonance. And you have to do the techniques of auscultation just like the percussion, and you have to auscultate on the same areas which we have done where we have done the palpation. uh, the areas are the same, but you have to auscultate here. For bronchophony, you have to ask the patient to say 99 or any other word in normal voice, and auscultate several symmetrical areas over each lung. The sound you hear should be muffled and indistinct. Louder, clear sounds are called bronchophony. So the last one is whispered pectorality. Uh, you have to ask the patient to whisper anything or any number like 99 several times, and you have to auscultate several symmetrical areas or each lung, but you should hear only faint sounds or nothing at all. And if you hear sounds clearly, that is the whispered pectorality. You must have to perform whispering pectorality. You will ask the patient to whisper like 99, 99, or any other word like 44, like 44. And on auscultation, if you hear clearly, then it means that whispering pectorality is positive. And then you have to do the relevant examination like examination of the hand, and in hand you have to check the signs of clubbing or any cyanosis, in which the we have cyanosis is the in cyanosis we have decreased oxygen supply, and you have to check the respiratory tremors, like you have to ask the patient to stretch out the hands, and then you will feel that is there any tremors or not. And then you have to check the radial pulse, blood pressure, temperature, and lymph node, and you have to examine the oral or mouth for central cyanosis, and and you have to check also the anemia, and you have to check for the JVP and edema. Okay, if the examiner asks you to present your case, and then you have to present like this, that sir, I have examined the chest of the patient, and I have inspected, and palpated, percussed, and auscultated uh, the chest of the patient, and my findings are this, whatever your findings are. But if the patient is more normal, then you have to tell that I have no finding. The shape of the chest is normal, and symmetry was normal, and there was no abnormal movements. There is no visible scar, and the chest of the shape of the chest is normal, moving comfortably with respiration, and on palpation, the respiratory movements were normal. There was no abnormal movements on any side, and on percussion, the note was resonant throughout the chest, and on auscultation there was no added sounds, and I hear the proper breathing sounds. And there were no sounds, no abnormal sounds like crafts, wheeze, or ronchi. So it was all about chest examination. I hope you understand a little bit, but it's more easy if you do it practically. Inshallah, we will repeat it again once you get back to the college, and practice it at home on anyone. Mm, Inshallah, we will repeat it. Okay. Thank you so much. Allah Hafiz.